Wes Streeting.
Thank you, Mr Speaker, and a Happy New Year to you and to the rest of the House. And I thank the Health Secretary for advance sight of his statement. Mr Speaker, this winter has seen patients waiting hours on end for an ambulance, A&E departments overflowing with patients, and dedicated NHS staff driven to industrial action in the case of the nurses for the first time in their history because the government has failed to listen and to lead. I noticed the Secretary of State didn't take a moment to talk about the abysmal failure of his talks with nurses and paramedic representatives today. So let me say to him, every cancelled operation, delayed appointment and ambulance disruption due to strikes could have been avoided if he had just agreed to talk to NHS staff about pay. Today he could have opened serious talks to avert further strikes. Instead, he offered nurses and paramedics 45 minutes of lip service. If patients suffer further strike action, they will know exactly who to blame. But of course, the Prime Minister has already shown that he's not interested in solving problems. He resorts to the smokescreen of parliamentary game playing by bringing in legislation to sack NHS staff for going on strike. So let me ask the Secretary of State, in these NHS sacking the staff bill, how many nurses is he planning to sack? How many paramedics is he going to sack? How many junior doctors is he going to sack? And this government has the audacity to ask NHS staff for minimum service levels. When are we going to see minimum service levels from government ministers and the entire government? After arriving at the Derriford Hospital in Plymouth, an 83-year-old dementia patient waited in the back of an ambulance outside A&E for 26 hours before being admitted. This was the 23rd of December, when no strikes were taking place. The Minister should listen. His family found him in urine-soaked sheets, and since arriving in hospital, he's contracted flu. His daughter said of the hospital staff, and I quote, "They're polite, they're caring, and they are trying their best. It's just impossible for them to do the work they want to do." So let me say what the Health Secretary and Prime Minister refuse to admit. The NHS is in crisis, the biggest crisis in its history. It is clear to the staff who have been slogging their guts out over Christmas. It is clear to everyone who uses the NHS as a patient. The only people who can't see it are the government. What has been announced today is yet another sticking plaster when the NHS needs fundamental reform. The front door to the NHS is blocked, the exit door is blocked, and there simply aren't enough staff. So where is his plan to fix primary care so that patients can see the GP they want in the manner they choose? After 13 years of Conservative government, they don't have one. Where is his plan to recruit the care workers needed to care for patients once they've been discharged from hospitals and to pay them fairly so that we don't lose them to other employers? After 13 years of Conservative government, they don't have one. And where is his plan to train the doctors and nurses and health professionals the NHS needs? After 13 years of Conservative government, they don't have one. Well, we do, Mr Speaker, and he is welcome to nick Labour's plan to abolish the non-dom tax status and train 7,500 more doctors every year, 10,000 more nurses and midwives every year, double the number of district nurses and provide 5,000 more health visitors. A plan so good, Mr Speaker, the Chancellor himself admitted the Conservative government should nick it. But after 13 years of mismanagement, underfunding and costly top-down reorganisations, all the Conservatives have to offer the NHS is a meeting and photo op in Downing Street. The collapse of the health service this winter could be seen coming from a mile away. Health and social care leaders were warning about it last summer. So why are the measures he set out today being announced in the middle of January? Why have care homes and local authorities been made to wait till this month for the delayed discharge fund to reach them? It's simply too little too late for so many patients. And in fact, this government is so last minute that after announcing this plan last night, they found an extra £50 million and sent out another press release. Now, I know most of us are happy to find a spare fiver lying around the house we didn't know was there. This Prime Minister seems to have 50 million quid stuck down the back of the sofa. What on earth is going on? No wonder they can't get money to the front line. The left hand doesn't know what the right hand is doing. And, Mr Speaker, this is intolerable for patients who are fit and ready to leave hospital, who are then stuck there for months because the care they need isn't available to the community. They're not bed blockers, and, Mr Speaker, they are not an inconvenience to be dropped off at a hotel and forgotten about. No. They need rehabilitation at home rather than a bed in a care facility. Vulnerable patients deserve proper support suited around their needs, or they'll fall ill again and go back to hospital. Right. And what about all these beds the NHS is procuring? What about the capacity that families need? I'll tell you what will happen. They won't get the care, and they'll be coming right back through the front door of the A&E. The cycle of broken systems repeating themselves again and again. And, Mr Speaker, where is the choice and control for patients and their families who may not want to be discharged to a hotel? I'm afraid, Mr Speaker, after 13 years, this just isn't good enough. The Prime Minister might not rely on the NHS, but millions of ordinary people do. They are sick and they are tired of waiting. And look, 13 years of Conservative government now, 13 years, and look at what they have done to the NHS. Did the Health Secretary listen to himself? Has he described the situation in hospitals of people waiting on chairs for discharge, sees the trolleys in the corridors and people waiting longer than ever? Whose fault is it? Not the NHS staff he's threatening to sack, Mr Speaker. It's the Conservative ministers who've made disaster after disaster. After 13 years of Conservative government, it's clear the longer they are in power, the longer patients will wait. Only Labour can give the NHS the fresh start and fresh ideas it needs.
Well, Mr Speaker, he talks about a fresh start, but even his own shadow cabinet colleagues don't seem to agree with his plan. His own deputy seemed to distance herself from his plans to use the private sector. And his own shadow chancellor seems to distance herself from his plans for GPs. And perhaps he can share with the House exactly how much his unfunded plans for GPs will cost. Because the chief exec of the Nuffield Trust has said, quote, it will cost a fortune and are based on an out-of-date view. So the point is, he has no plans that his deputy and his own colleagues support, and he has not set out how he would fund those plans in a way that would not divert resource from other parts of the NHS. He talked about pressure, Mr Speaker, and yet there was no mention of the fact that the NHS in Wales, the NHS in Scotland, and indeed health systems across the globe have faced significant pressure as a result of the combination of COVID spikes and flu spikes, particularly in recent weeks. This is not a phenomenon that is limited to England and the NHS. This is a pressure that has been reflected internationally, including for the NHS in Wales. He refers to talks with the trade unions, and it is right that we are engaging with the trade unions. I was pleased to meet the Staff Council of the NHS today, and indeed the chair of the NHS Staff Council, Sarah Gorton, said the discussions had made progress, notwithstanding one trade union leader who wasn't in the talks, given an interview outside the department to comment on what had and had not been said in those talks. But we want to work constructively with the trade unions on that. He says that we are only announcing measures today, Mr Speaker, but again, he seems to have written those comments before he got a copy of the speech. The Integrated Care Boards took operational effect in July last year. The autumn, because they are scaling up, we're putting control centres in place. We are integrating health and social care. We announced in the autumn statement, Mr Speaker, 500 million for discharge, a further 600 million next year, $1 billion the year after, recognising the significant pressure, and that is ramping up. NHS England set out its operational plans in the summer, including the 100-day discharge sprint. That set out, for example, the greater use of virtual wards. That is new technology that is being rolled out at scale. It also announced the extra 7,000 community beds. And indeed, we also set out in our plan for patients the additional measures. But what is clear when we have a sevenfold increase in flu in a month, 50 cases admitted last year compared to 5,100 this year, you have a combination of a surge in supply on top of an existing high-level position, and that surge in demand corresponds with a constraint of supply because staff absences also increase because of flu. It's during the Christmas period when community services are more constrained, and those two together has created very significant pressure on our emergency departments, and that is why, through the engagement I have had with health leaders, the two key messages they gave to me was the importance of getting flow into hospitals, which is constrained by the high bed occupancy. That is why getting people out of the hospital is so central to relieving pressure. And secondly, that within the emergency department specifically, we need to decompress those services. And so with same-day emergency treatment, having short stay post the emergency department, that is a better way to decompress those emergency departments through the triaging and bringing other clinical specialties closer to the front door. We have listened to the NHS frontline. Those were the two key requests that were made to me, alongside other issues such as CQ inspections and how we flex those. But we also need to, alongside those immediate pressures, recognise that we had pressures last summer during the heat wave, we had pressures in the autumn, and that is why we've announced a wider set of measures today. So we have listened, we have acted, we've taken measures to deal with the immediate pressure, but we've also set out how we will build further capacity, which will go through into the autumn, and then alongside that we've signed deals, for example, with Moderna and BioNTech, and we're bringing forward the life science investment so that has a better impact on pressures on the front line.